you have the issues that are important to you, if you're an employee, if you're a politician,
It's McDermott.
wherever you are, we need to get your name on the list. We're like a little when we get there. Short and minutes now, okay? Big crowd, we don't want to let phone calls. If I was
All right, I'm gonna get to it. Okay, thanks.
What's up, man?
Hey.
Hey, that audio worked out great.
Awesome, great.
I just had to sync it up. That was hard.
Right.
License, right? We don't. Intellectual again.
You been good, Nate? Yeah, we can dance. It's all good. I don't want to dance. Mike, we're going to do an availability right here. Maybe C7. I'm around here getting B-roll. There you go. It's the water that's coming.
Tommy. So half the kids. Well, now you get to learn on that one, huh? I don't want to learn. I know the concept.
Joe!
French.
We're just trying to save kids who are ambulatory. They can't. Their parents. Yeah, I know. I know the problem. I mean, but you can't argue with me on this. It's too far down.
It's something.
Trust me, we looked at it. We said, I called City Hall people. Which road?
fine. You carry one.
Enough is enough. Hospitals need a community. You see the community behind us. They're tired of it. The Bible says, what's for the profit of man in the world? They're not for the people. Their mission should be feeding the people, the needy. That's what their mission is. They're not following their mission by closing this hospital. Enough is enough. That's right. We're tired. We're tired in Calumet City. We're tired in Hammond. We're tired in Dalton. This hospital helps people miles and miles apart. And it's time for the hospital to realize their reach. Enough is enough. We're going to not only protest today, tomorrow, we're going to stay here until they come to the table.
That's right, Mayor.
And say they're not going to close this hospital. I'd like to introduce Mayor Robert Polk from the Village of Vernon.
Yeah, Mayor.
I'd like to say good afternoon, everyone, and thank everyone for coming out. I think everything has been spoken today. It's been very true and committed. We're going to fight to try to keep this from happening. As Mayor Jones said, Mayor McDermott has said, several hospitals have closed throughout the region, and we need this hospital. Amen.
Thank you, Mayor.
We'll take any questions.
You know, one thing that scares me is if this is the way America's heading, you know, where are we going to be in 10 and 20 years from now? The hospitals are only where the wealthy are? And if you're poor, too bad, no hospital? I mean, the Catholic institutions should lead the way. They got $3 billion in the bank. I think they can help make the tough decisions so that they make this work. And I want to thank the community for being here.
We'll take any questions.
Mayor, just a couple questions. I see the support of the community here. The hospital just sent me a statement saying, and I'll read it verbatim, that in the last, I guess, couple of months, hospital intake has gone down drastically here. They're saying they're not seeing that many people in terms of intake a day. What do you say to those numbers? They're saying it's a lot of unused space here, and that's why the downsizing is happening.
Tell them to say that to the black families that have lost their lives. Tell them to say that to the white families that have lost their lives. Tell them to say that to the people that actually mean and it matters, not to that corporate interests that they're trying to protect. If they really mattered, they will be out here with us instead of releasing statements that don't matter. $3 billion doesn't equal the people's lives we need to save. We need this hospital. We don't need phony statements from St. Francis.
Sure. Pardon my ignorance, I'm not too familiar with the area. If this hospital, in fact, downsizes, talk about other healthcare facilities in this area. What will the disadvantage look like? Just for folks that may not be familiar with this area.
We have no hospitals in this area. We have clinics that can help you. We have an emergency room that's for profit on the south side of town that's real small. But the hospital, when those came to Hammond, we were fought by St. Margaret's. It's like, hey, you can't bring competitors in here. If we would listen to them, I mean, where would we be right now? We'd have nothing in Hammond. But let me tell you something, when they talk about declining populations at that hospital, when you build competitors in all the wealthy communities surrounding Hammond, away from Cal City, where do you think the patients are going to go? If I have a brand new restaurant and I put it over there, I bet you people aren't going to go to El Taco as much because they're going to go to the new place, right? So why don't they invest some of their billions of dollars right here in Hammond, and you'll see patients come back, right?
My very last question is, are you all also kind of upset in terms of the hospital's process for deciding this? I'm interested to learn if they include any of you all in this decision making. How many of the residents that they speak to that they talk about?
I was standing right here when I found out. walking into a staff meeting in a very busy day, and I think if you talk to my fellow mayors, our weeks are scheduled out weeks in advance, right? I'm walking in there and they say, I need to meet with you today, Mayor. We're having a press conference in an hour and I want to let you know what's happening. I had 1 hour notice that one of our largest employers in the city of Hammond and our only hospital is shutting down. That's good communication, right?
Yeah, it's unchristian. So how do you feel about that? How do you feel about that? The fact that they left you all out of this process.
Mayor Thaddeus, that's Mayor Thaddeus.
Church unchristian. Still betrayed. I mean, they need to invest in here. 80% of decline in population. We get 8% of the calls from Illinois and Calumet City, and it's important in Hammond. So they talking about a decline in population. Invest in the community and let's build it together, as opposed to making these excuses.
Yeah, time for a few more questions, Mike.
To answer your question, Calumet City did not get notified. Did the Village of Burnham get notified? No. They did not notify these surrounding communities, and they're lying to say that they did. And I can tell you for a fact that none of us got notified.
I still haven't seen anything. To this day, I haven't seen their plans. It's just, we're demolishing it and we're leaving. That's what you do in Baghdad when you take it over. You take it over, you demolish it, and you leave. We're not Baghdad, we're on the same team.
Mike, you got a question?
Do you believe enough pressure can be brought that they, like you said, that should they come to the table, or do you think you can actually get them to
We got the funds. We have the communities together behind us. We're going to put the pressure on them. They got $3 billion. $3 billion. So stop answering to your corporate lobbyists and corporate people and answer to the community. Yeah. Come and talk to the community and tell the community that we are here for you as opposed to walking away. When they did it in St. James, they moved the hospital to Olympia Field. They're trying to do the same blueprint here in Hammond.
That's right.
By moving it out of an area that desperately needs a hospital. No more excuses. Leave the hospital here.
They move it from Chicago Heights and they go to Olympia Fields. They're moving it from Hammond and they're going to Crown Point and Dyer. That's the same playbook, different state.
Mayor Pope?
Mayor Pope.
Again, like you said, I support everything that you're saying today. We have a lot of people coming to the hospital that need the services, poor people at a disadvantage, and we need the hospital. So that's enough said. So save the hospital.
So just so I'm clear, because their words are going to be that they're not ending the hospital. Just hear me out. They're saying that they're downsizing services here. Is you all's response to that this current downsizing will eventually lead to a full-out phase-out? Is that what you're saying? Is that the fear?
Hammond's the largest city in Northwest Indiana, all the way out to South Bend, the largest city, and we're without a hospital now. And they're telling me, Mayor, we're downsizing your hospital 90%, but at least you have 10% left, right? That's not a good deal, right? That was a good deal when I was in the Navy. I'm not in the Navy anymore.
They're not downsizing the Vatican. Same playbook they said at St. James. We're downsizing, we're going to leave you with an ER. Go look at St. James now. It's a vacant lot. They're not going to downsize. They're trying to close that hospital and demolish it.
That's right.
They want condos instead of having a community hospital. Tell them to stop it.
Any more questions?
It's over in Hammond, this director.
I'm hoping they come to the table and talk and say, hey, we didn't realize how much you loved the hospital. We didn't realize how important it was to the community. We're hoping that maybe we thought things out. We have another plan. I hope that that's what I hear from them. That's what the Catholic and the Christian thing to do would be.
That's right. Christian thing to do.
Did you send me the script? Do you need his number?
We know that Calumet City and Hammond,
Do you need his
the
number?
women and the children in our community are they're the ones that come to the hospital. They need this hospital. These are families here today. So tell the corporate leaders to come out and look at the women and children in their faces and tell them why, honestly, they're closing this hospital. It makes no sense. Take $1 billion of those $3 billion and invest it in Hammond and let us do it. We'll do it right. Give it to us if you don't want it. We'll take the hospital.
Yeah.
Any other questions?
If they don't want it, we'll take it. We'll work it out. It's fun, Calumet City. I'm sure Hammond would help us out.
And Burnham too.
Burnham too. I'm sure we could get a community rally behind it.
Yeah.
Going once, going twice. We good for guys?
We're going down the street now. We're going to go in front of the hospital and do some speeches. We appreciate you guys being here. Sure. It's right down the street. You're on Douglas Street right now. We go by 18th Street if anybody gets hungry or thirsty. We go right down and we end up at the hospital, which is right down the street. Thank you, everybody, for being here. We appreciate you very much.
Thank you, guys. Appreciate
Thank you again to everybody. Miss Mary Ellen Slazik, could you get us started? Be our first speaker. Mrs. Slazik, are you around? Mary Ellen, are you around? Mary Ellen Slazik, can you come over and start us off? Hi, Mary Ellen. Hi, everybody. We're going to get started with Mary Ellen Slazik, who wants to speak about the closing of the hospital. Could you give her a big round of applause?
That's right.
They don't care about us.
That's
Their
right.
bottom line's $1, and that's all the heck they worship here is the free and almighty dollar. What about the people here?
Yeah.
They don't want us here. We're not putting them
Go get her, Mary Ellen.
They don't like our demographics. They don't like our bank accounts. So they go out there when they got plenty of dough, and then they influence everything you and me. We can't let this happen. This hospital is vital to the safety of our community.
Are we ready for one? I think, honestly, I think we should focus on money in the bank, the Christian-like thing to do. It just doesn't make sense. There's multiple communities impacted by this. You know, just last year we had a world-renowned planner in Hammond, Indiana, at the table with us with St. Margaret's the whole time, talking about downtown Hammond and how wonderful it's going to be. Not once did they mention to us that they were planning on downsizing 90% of their hospital. How many people here had friends or family or themselves born at that hospital? Raise your hand. How many people here want to drive an extra 20 miles for routine health checkup, huh? We got to fight, guys. I appreciate you being here. Does anybody else want to hit before we leave? Matt Muda. Give it up for Matt Muda, everybody.
Hi, I'm a member of the Hammond Mayor's Commission on Disabilities. On behalf of the Mayor's Commission on Disabilities, we have condemned the action taken by the Franciscan Alliance. We believe that these actions that they have taken within the past few weeks will adversely affect sick, elderly, and most importantly, disabled people within Hammond and in the surrounding communities. Again, it's important that these actions and its
But we're saying this is the only trauma place around here other than going to East Chicago. That is too far. We live right here by the hospital. So I'm saying, let's save the hospital. Let's do whatever.
What's your name, man? Diego wants to say something. Give it up for Diego, everybody.
Thank you, Mayor. Thank you, everybody, for being here. Just a couple weeks ago, this hospital, this very hospital that's down the street, has saved my sister from an accident that had us happened a couple weeks ago. This is not Catholic or Christian values at all. This is the only hospital that we have by our community, and this is not right. Once again, this is not Catholic nor Christian values.
Give it up for Diego, everybody. I'd like to introduce the pastor of First Presbyterian Church in Hammond, Indiana, Mike Penniman. Give it up for Pastor Mike, everybody. Just wrote a very nice letter to the editor on behalf of the citizens of Hammond. I want to thank you very much, Pastor.
How do you use one of these?
All right.
So, we've heard about all the challenge and all the activities that they have done. Okay, it's all on target, but I don't want to demonize them. What we want is to bring them to the table. That's right. What we want, in my view, is to have them come and say, yes, how can we work together? We want to push them into a corner like an angry dog saying, oh, we're just going to fight you all the way. What can we do to bring them to the table? To realize we have to see them as partners for the sake of this community.
Thank you. Thank you, Pastor. Anybody else want to say anything before we start marching? Again, I want to thank Mayor Polk and Mayor Jones from Calumet City. Can you give them a big warm welcome, everybody? And we're going to have everybody speak down the street, so, let's start marching now. Thank you again, everybody. Now we're going down to the hospital. We're going to the parking lot, Kevin.
Okay, so the plan is to walk down Douglas to Homan Avenue, and then cross the street onto Homan, and then take a left on the sidewalk to Ogden. That's where we're going to rally, at Ogden and Homan. So down the street to Homan, cross Homan, a left 1 block to Ogden. That's where we're going to rally. All right?
Save our hospital!
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 Let's go! Save our hospital!
Save our hospital!
Ideas like this, that's why you make the big one, right?
of people showed up for this, so we need to give everybody time to get up here. Keep coming in, everybody. All right, we got a few people that have messages for the hospital. That's why we're here today. But let's start with the man who is leading us today and being very vocal and loud about what the decisions this hospital has made, how they will affect everybody who is here, and all of Hammond, and a lot of Illinois, and a lot of Northwest Indiana. So let's bring them up now. Mayor Thomas McDermott Jr. All right, we're going to get this started. I want to say thank you first off to everybody for coming out. I'd like to introduce Dr. Bagwa. Can you please come forward, sir? He wants to say a few things. Dr. Bagwa knows a lot more about this hospital than we do because he works here. Give him a warm welcome, everybody. Hello. I have been working here. I have been working here for the last 34 years. Right here. I served the community of Hammond and Calumet City, for the last 34 years. I understand that this hospital has gone a lot of changes. It used to be a 300 to 400 bed hospital when I started in 1985. Now it is down to 100 beds. But still, we are busy. The hospital is busy. I'm seeing every day so many patients. The hospital is losing money. We know that. But the entire organization, from volunteer fees, Minneapolis, they are making good profit. And also, this is a pandemic time. This is not a time to close the hospital. My request is be charitable, be Catholic, and save the hospital. Give it up for Dr. Bagwa, everybody! I'd like to remind everybody, we're in a pandemic last time I checked, right? Who shuts a hospital down in the middle of a pandemic? That is not the Christian thing to do. I'd like to introduce Pastor Paul from New Hope Baptist Church. Give him a warm welcome, everybody.
On my walk over here, where's my friend? I'm Sam. There he is. We had a conversation. He's lacking the faith that what we're doing will do any good. Let me share with you. Gary was in the same predicament. We have faith, but we have feet. We need as many feet as we need faith.
That's right.
As many times as we need to march and allow them to understand this is a life and death decision.
That's right. Yes.
We need this hospital.
Yes.
That's right. Let's continue to walk. Let's continue to pray.
Yes. Thank you, Pastor Paul. Save our hospital. Save our hospital. Save our hospital. Next, I'd like to introduce Hammond's 3rd District Councilman Barry Taylor. Give him a warm welcome, everybody. It's been a long time since I used a bullhorn, so let's see if this works.
come to us and have the decency to have a conversation with us about their plans because they knew that we would oppose it. They knew that we have a mayor, a city council, police officers, first responders that care about the health and well-being of our residents that we would not stand for. And that's why they didn't do it. So like Pastor Polk said, we have to continue to come together. We have to continue to fight and do whatever it takes to keep this hospital at least a brick and mortar here so that we can bring in somebody else who does want to be here, who does care about our community and wants to save us and be here for the long term. The last thing I'll say is I've been a sports coach in the schools in Hammond for 15 years. I can't tell you how many nights I've been here with players who have injured themselves right down the street at Hammond High, and they come here because it's the closest hospital, and a lot of them have had severe injuries, and they've been taken care of right here. It's been easy for their parents to come here, for their families to come here, and it's sad that we will no longer have that opportunity if this hospital is able to leave us. So please continue to come out, please continue to fight. If you're watching online, there's still time to come out, do whatever you can to help save our hospital. Thank you.
Save our hospital! Next, I'd like to introduce Hammond's Corporate Counsel, Kevin Smith. Give him a warm welcome, everybody.
Thanks, Mayor. You know, I just wanted to give everybody some statistics because I got these from the fire chief. Because there were some things said in the paper recently that made it sound like all the patients from Hammond are getting transported down south, right? Did you see that in the paper today? All right, here are the real numbers. The Hammond Fire Department transported the following patients to these hospitals. Christ Hospital, 27. This is last year, all of 2020. University of Chicago, 35. St. Catherine's in East Chicago, 1188. Munster Community, 1637. And right here behind me, 2,140 patients. This was number one. Don't believe what you hear in the paper. Don't believe those statistics. This is where Hammond takes their patients. That's why this is so important. So I want to thank the fire chief for those numbers. And this has been a great turnout. Get ready. Save our hospital. Save our hospital!